Awesome, awesome, guys. Thank you for showing up for Wellness Wednesday. Here we are, mid to late February, where we got ice storms going across the country. But hey, it's showing up. So excited for tonight. You're part of this Wellness Wednesday. You've been invited by a friend, or maybe a family member. We've created this group to give people information to help them and their families with health and wellness. So if you hear things tonight that you find valuable, please share this with those that you love and care about, and invite them to the next one. We do this each Wednesday. Tonight we have a special guest. Her name is Suzanne Barker. She's just a wealth of knowledge, background in nutrition, been counseling and coaching physicians and real people, I call them, on how to get healthy and stay healthy through diet and nutrition. She worked for a specialty lab company where they can test and find out what's really going on with individuals. And I like Suzanne for a lot of reasons. Number one, she's a mom. She's a Christian, but she lives it. Like, not only just can she teach it, but she lives it. And so just grateful to have her as part of kind of our family, and basically got to know her over the last few years. So Suzanne, thank you so much for taking your time and sharing your expertise with us, so we can be more healthy ourselves and share it with others. So take it away, please.
Okay. Can I share my, I'm able to share my screen.
Yep. Your co-host, yep.
Okay. All right, very good. Okay, so welcome to what you need to know about omega-3s and heart health. So February is Heart Health Month. So that's kind of what there's a lot of benefits to taking omega-3s, but I'm going to kind of keep them tonight related to heart health. So this is one of the things is, there's a lot of things that we can do to increase heart health. Heart disease is still one of the major causes of death, and probably worldwide, and especially in America. And so, but a lot of this is preventative, and that's kind of what we want to focus on. So omega-3s. Omega-3 is a type of fat. Sometimes fat, gets a bad rap, but this is a healthy fat. This is an essential fatty acid, meaning that the body does not make it. So we either have to eat it, eat foods that contain it, or we either need to take a supplement. So that's kind of what we're going to focus on. And some of the other things that omega-3 is good for, besides helping heart health, is to reduce depression, dementia, arthritis, basically inflammation in the body. So while you're improving your heart health, you're going to improve every system in your body. And I think this is one of my messages every day, is that we're not divided into parts. We are a whole system. So you improve one system, you're going to improve all the systems. So I really, really think that's key. Okay, so omega-3 fatty acids are, there's three types, but the first one I want to mention is from plant sources, which is alpha-linolenic acid. So we find this in flax and nuts, things like that. The issue with this, even though it does have omega-3s, these have to be converted into EPA and DHA, which is the form your body actually uses. So DHA is docosahexaenoic acid and EPA is icosapentaenoic acid. And these are the two main sources of omega-3 that are beneficial. So if your body has to break down ALA into these components, you can see that it's probably much more efficient for the body if you just take them already in their components. So the main thing to remember about DHA and EPA is the one that really targets inflammation in the body. So that's really, really key. And then DHA is more a brain support. So they're both very critical. One of the ways that omega-3s can really help heart health or increase your heart health is through reducing inflammation. So we know that cholesterol is not really the big problem with heart disease, although that's what's been focused on in the past. It's really inflammation. So when you have a lot of inflammation, this can cause unstable plaques in your arteries. Different, like you can get hardening of the arteries, all these different these inflammatory factors that build up and clog the arteries. So this is going to be one of the really important points in keeping your heart healthy, is to keep that inflammation down. We know that if people already have heart disease, even the American Heart Association, which a lot of our Western medicine hasn't been on board with a lot of supplements, but the American Heart Association does recommend 1 gram a day of combined EPA and DHA for people with heart disease. So even studies have shown that people that have had heart attacks that show fewer heart attacks and fewer heart disease deaths among heart attack survivors who increase their omega-3 levels. So that's pretty impressive. So on this slide, we can see that there are different, foods containing omega-3s. So it's going to be like salmon, tuna, anchovies, sardines even. And then some of the plant sources are walnuts, broccoli, and edamame, which is kind of surprising because there's not really, doesn't seem like there's a fat in those foods, but they do contain these omega-3s. Another area where omega-3 can really help is cutting down triglycerides. So triglycerides are circulating fats in the blood, which are really elevated by processed foods, too much sugar in the diet, too much alcohol, things like this. So while this is not a magic pill, it's going to be helpful. So you're still going to have to work on that diet, improving the diet, reducing these processed foods and sugars. The average American consumes 150 pounds of processed sugar a year. That is just staggering. So you can wonder why the average American is not in great health, because they're consuming so much sugar and processed food. So reducing these triglycerides is going to really help improve your heart health and reduce that inflammation. Omega-3 is another thing they can do, is help regulate blood pressure. So we don't, high blood pressure can be associated with things like strokes and different things like that. One of the ways that omega-3s help prevent strokes is they help support the blood vessels and the blood flow, and they because they're anti-inflammatory, they can also reduce that, like we said before, that buildup of plaque that can clog your arteries and causing a stroke. So while they do have a blood thinning component, they're usually not going to thin your blood too much. The only time you would really have to kind of maybe be a little bit cautious if you're already on a blood thinner. Some doctors are kind of I don't know, on the fence about whether you should add omega-3, but I think it's very beneficial, because I don't think it's thinning the blood too much. I think it's thinning it to a healthy level. But I know, like, my own father is on a blood thinner and does take omega-3, and he does really well with that. So just to keep that in mind if you're on a blood thinner. Okay, so some of our best sources of omega-3 in foods, and ideally we do want to eat some of these high omega-3 foods like salmon, tuna, mackerel, sardines. The important thing to remember is the sources of these foods. You want to eat wild-caught salmon. You want to eat safe catch tuna. Costco carries a safe catch tuna that every fish has been tested for mercury. So what we don't want to do is increase these types of fish that tend to carry heavy metals and then get toxic from heavy metals. So we do want really good sources of fish. I don't recommend eating farm-raised salmon or just regular canned tuna, things like that. Sardines are pretty good if you like them. if you can kind of get used to them, I would get a wild sardine. Costco also carries those, but you want a really good source. So one of the problems is a lot of people don't eat fish, or they don't eat enough fish. So I think it is very beneficial to take an omega-3 supplement. But again, just like the fish, you need a really good source, because you need a trusted source that's not going to contain the heavy metals, the mercury, and things like that. So you don't just want to go buy a cheap fish oil. It could have rancid oils in it, could have the heavy metals. So you really want to know your source. The one I take, I mean, it can be traced to the boat where they catch the fish, and so we know the quality, we know where, what's in it, we know where it's caught. So that's something that's really, really important. So again, we want to focus on our diet. We want to increase our foods that contain omega-3s, and we want to almost every one of us will need an omega-3 supplement. I even worked with a patient that she decided she was going to eat a can of sardines a day, so she wasn't going to take a supplement. And we tested her. I said, okay, let's go for it. And she got really close, but she never could get her omega-3s up into the good range. And so she ended up having to also add an additional omega-3 supplement to her daily sardines. So I do encourage you to eat some of these fatty fish, but also I do encourage you to take a supplement as well. Okay, I mean, that's basically the benefits to omega-3 and heart health, and reducing that inflammation, reducing your risk of plaque buildup and blood clots and triglycerides. So does anyone have any questions?
So yeah, awesome. Thank you, by the way. It's phenomenal. So is there an optimal dosage that you recommend people take for, let's say they are looking to like optimize versus maintain?
Yes, there is. So because I look at labs all day, I do a cellular inflammation score. It's actually, it's in a micronutrient panel. So it's like arachidonic acid divided by total EPA. And so because if that cellular inflammation score is elevated, remember the essential fatty acid makes up the cell membrane. And so if you have inflammation at a cellular level, you're not going to absorb nutrition like you should, and it's just going to be very problematic. And so I will recommend a high EPA product, or if they're taking a quality fish oil, I want them to get to around 500 milligrams of EPA a day. However, if you're taking a really good quality source, that's going to outweigh, taking a lesser quality and more of it, if that makes sense. So,
Okay, so am I hearing you correctly? So dosage matters,
it does.
quality matters,
Mm-hmm.
and length of time taking it matters.
Yes.
So
So,
just out of curiosity, Suzanne, because you've done a lot of labs, how many normal ones do you see? Like not normal, but optimal.
Optimal. So I look at labs all day, every day. I see an optimal one about once every 3 months.
Okay, and so how many labs are you looking at, just on average? We'll just give us an idea. So that one every 100, one every 200.
Yeah, about one every 200. Mm-hmm.
Okay.
That would be
so I appreciate that, because that's kind of what I've seen too. It's very rare.
It's rare
to have an optimal range on anybody.
Exactly.
So, yeah.
Exactly. And I know I talk to people every day, and I say, I talk about fish oil, and they say, oh, I have some. I'm not even kidding you. This is so common. I'm like, well, it won't help you in the bottle. You have to swallow it. So
I love that. I think the only optimal ones I've ever seen were people already taking fish oils, actually.
Oh, absolutely. I've never seen one that somebody wasn't taking fish oil. I've never seen that. Mm-mm. Like I said, the lady she ate a can of wild sardines every day for 4 months, and we retested her, and she still wasn't optimal. No, she was close. But she wasn't in the optimal range.
Yep.
It was really amazing.
I think I'm taking the fish oil. I don't like sardines that much.
I do love salmon, but I'm not going to eat wild salmon more than probably once a week. I do eat tuna as well, but I'll eat a sardine, but I have to take the fish oil. for sure.
I have read that, and in our family, we're trying to cut down on the amount of meat. Is it really true that if you eat grass-fed beef, the fats are a better quality, or I don't want to say healthier, but is it a better quality fat than all those farm-raised animals? Because I refuse to buy red meat that's not farm-raised. I mean, that is pasture fed. So is there any validity to that?
There's absolutely. And the reason why is because in fact, the old recommendations that say don't eat red meat. So this is the reason when an animal is given hormones and antibiotics and things like that, that's stored in the fat. Okay. So now you eat the meat and you eat the fat, you're getting all the hormones and the antibiotics, and it's causing disease in your own body. But it's not the fat that's a problem. I mean, it's not the fat that's a problem or the meat, it's those toxins. So if you're eating a pasture-fed animal, you're just getting, a clean, grass-fed beef, there's really no problem with that. So, I mean, it's a good source of protein. We don't need to overeat protein in general, but I think like I eat grass-fed beef, it's just, and I look at a lot of factors when I talk to someone about diet, but so everyone doesn't have exactly the same diet, but I think the main thing is that you're eating a clean, healthy source, like you're saying, because when those recommendations came out, they were looking at, cattle from feedlots. These aren't healthy animals. I mean, in a cow, they have 3 stomachs. They have like a rumen, a mason, and abomason, and that, as they eat that grass, that ferments, and that's, they chew the cud, and that ferments, and it creates this healthy microbiome and healthy bacteria. And so that's how a cow maintains health. If you take that cow and you put them, over here in a muddy environment and feed them corn, that's not their natural diet. So now, they're not having good bacteria, they're having bad bacteria. Now they have to have antibiotics. Now they have to have, give them hormones and all these things. That's all stored in the fat. And so when you eat that, you're getting all of those things that you don't want to consume. So that's kind of where those recommendations stemmed from, not from grass-fed beef.
Oh, thank you.
You're welcome.
I love, Suzanne, how smart you are. You should be on Jeopardy. That's awesome.
Well, my undergraduate degree is in animal science because my original intent was to be a veterinarian.
Well, the reality is then the smartest people I've ever been around are the ones that actually studied animal science in the medical world, because they have to study all the animals, not just the human animal.
It's true.
It's unbelievable. So thank you so much, Suzanne, for hopping on and sharing your knowledge and expertise with us. Next Wednesday, we'll have Wellness Wednesday again. Again, kind of wrapping up the end of the month, pretty much, this last week of the month, next month, right? On heart wellness. So please hop on and get your friends and family. And this is also the next couple of weeks is the week where if you are on LifeVantage product and you are getting the Tri-Synergizer, you can get a fish oil for free this month with a spot order. So if you have somebody that that wants to take that, it's a great way to actually get some product, or you actually can get one for half off with the NRF1. So if you have somebody that wants to take advantage of that, please let them take advantage of that right now. It's always nice to be able to get somebody to give you some free product or some discount off. So you guys have a phenomenal weekend or a week. Invite your friends and family back, and I look forward to seeing you again soon. Have a phenomenal night. Thanks again, everybody.
Thank you.
Bye. Bye.
Good night. Thank you.
You're welcome.
Thanks for watching. And remember, one change can have an enormous effect. Remember to subscribe, hit the bell and the like, and we'll see you next time on Love to Live.